The holidays are supposed to be a time of joy, but sad to say, in many cases, the absence of a loved one is felt more deeply over the holidays. In this video, we'll talk about how grief may negatively affect your health during the holidays and what you should do to minimize those effects. But first, be sure to like, share, comment, and subscribe for the latest from Red Button Journal. And now for the journal. What are some of the dangers to your health when you are grieving the loss of a loved one? Sleep disturbances. Insomnia is a common side effect of grief that may hinder mental and physical recovery. It's possible that you're having difficulties falling asleep, waking up often, or spending too much time in bed. Regular, restful sleep may assist. Go to bed and get up at the same time every day, and try to do something relaxing before bed like reading or taking a bath. Fatigue. The emotional toll of sorrow may deplete your energies. To keep up your strength, make sure to eat plenty, even if you don't feel like it. Even a 10-minute stroll may do wonders for your mental health. Connecting with loved ones on a regular basis has similar benefits. Support from a mental health professional or a local grieving support group may help you feel less alone and more equipped to deal with your loss. Immunity. Evidence suggests that prolonged mourning might weaken the immune system, making it more difficult to fend off sickness. If you are struggling to accept your loss, it may help to speak with a medical or mental health professional. Inflammation occurs when the body's immune system overreacts to a perceived danger, causing tissues to swell. It may have a role in heart disease, arthritis, diabetes, asthma, and even cancer. Studies have shown a correlation between sadness and inflammation. Greater intensity in grieving has been associated with more severe inflammation. It may be controlled with regular exercise and a healthy diet. Anxiety. Grief-inducing experiences might leave you feeling hopeless and helpless about your future. It's possible that you're worried about your monetary security, your loneliness, or the prospect of losing a loved one. While some degree of anxiety is natural and even healthy, when it persists beyond a few months or negatively impacts daily life, it may be time to see a mental health professional. Cortisol. This is frequently termed the stress hormone, and your body may produce more of it than normal in your circulation in the 6 months following the death of a loved one. Cortisol levels that are elevated for an extended period of time may increase your risk of heart disease or high blood pressure. Indigestion. Depression and anxiety are common reactions to loss, and both may disrupt normal eating patterns and contribute to weight gain. Also, the hormones released during times of stress may cause nausea and other gastrointestinal distress. Irritable bowel syndrome, ulcers, diarrhea, constipation, and stomach cramps are all possible symptoms. Your doctor may recommend treatments for persistent stomach problems. Aches and pains. Pain in the joints, the back, or the brain could all increase as a result of a recent loss. Part of the explanation might be the muscular strain induced by the stress chemicals your body produces in reaction to sadness. This should improve with time, but if it doesn't, you should see a medical professional about pain management options. Heart rate. It may take up to 6 months for your heart rate to normalize after experiencing significant loss. Anxiety or increased cortisol production may contribute to this increased pace, which in turn increases the risk of cardiovascular disease. Talk to your doctor before you add or change any of your medicines, especially if you already have heart problems. Broken heart syndrome. Hormones released in response to the shock of tremendous emotion caused by the abrupt death of a spouse or loved one may cause severe chest discomfort and difficulty breathing. Your heart may not pump blood as properly for a while. The symptoms are similar to those of a heart attack, although the damage to the heart and the blocked blood vessels is typically not permanent. In a matter of days or weeks, most individuals feel much better. Higher heart attack risk. When someone close to you dies, your heart attack risk increases significantly in the first day of sorrow. The chances are lower after the first week, but they can still be higher than typical over the first month. Attempt to get enough rest and be alert for symptoms of a heart attack, such as pain in the chest or stomach, cold sweats, nausea, and dizziness. Holidays, anniversaries, and other big events can bring up painful memories and feelings of loss. Be ready for the emotion and know that it's normal. You can plan ahead by making sure you're not alone or by coming up with a creative way to remember your loss. No one else can tell you when it's time to move on or get over it. Let yourself feel whatever you feel without shame or judgment. It's fine to get mad, yell at the sky, cry or not cry. You can also laugh, find moments of happiness, and let go when you are ready. When you're feeling emotional, taking care of yourself is more important than ever. Taking care of your body and your feelings will help you get through this hard time and have a happier and healthier holiday. Thanks for joining us. Be sure to like, share, comment, and subscribe for the latest from Red Button Journal.